I am Dr. MOSSA, Senior Consultant Cardiac Thoracic Surgeon, Meridian Hospital, Kolattur, Chennai. I am specialized in adult cardiac surgery and pediatric cardiac surgery. Recently, we had one interesting case here, what we call a patient who had out of hospital cardiac arrest. You know, out of hospital cardiac arrest, if occurs, the survival chance is very less than 1% in India, and only about 10 to 12% in advanced countries. So this patient, a young person, 38-year-old man, who was having diabetes but no cardiac symptoms. He never had any chest pain or breathing difficulty. One day, while he was shopping in a major mall in Chennai with his family, he suddenly developed chest pain and he collapsed there. And there was no pulse or breathing. So he was almost like dead. Suddenly, somebody from the crowd came forward and did a cardiac massage on him. And within a few minutes, the patient recovered and he started opening his eyes. Then quickly they shifted him in an ambulance to nearby government hospital, where he received the primary treatment. Then he was referred to our hospital for advanced cardiac treatment, because in that hospital they found that he has sustained an heart attack and his brain was intact, he was awake. When he was brought here, his breathing was very fast. He was in heart failure, severe heart failure, and evidence of heart attack. We admitted the patient. Then we intubated, or we connected the patient to the ventilator to stabilize his breathing and optimize his cardiac output. Then we did a coronary angiogram, which showed 3 blocks in his heart vessels known as the coronary arteries, what is known as a coronary artery disease. And then the cardiologist treating suggested to undergo do an emergency bypass operation on him to save his life. So at this moment I came into the picture. Then to stabilize the blood pressure, we put him on a machine called intra-aortic balloon pump to increase his blood pressure, and the patient was already on ventilator. So in front of us there was only very short period of time left to do the bypass operation. So we did the bypass operation on beating heart, that is without using heart-lung machine, very next day, that is within 12 hours of he reaching the hospital. And he survived, and we removed all the 3 blocks and he became all right, and he was sent from the hospital. He was discharged from the hospital on 7th day, and now he is doing very well. Now his pumping power of heart has come back from 39% to little more than to 45%. He is now able to walk. He is stable. His all wounds are healed well, and he is able to lie down and sleep well. So the cardiac arrest, sudden cardiac arrest is very common in India, especially in young people, and the most important cause is a heart attack, maybe due to the undiagnosed blocks in the coronary arteries. So this is a classical example, and this is probably the first time such a case report from in Chennai or from India, where out of the hospital cardiac arrest patient was saved and was subjected to bypass operation within 12 hours, and the patient became stable within 48 hours, and he could go home within 1 week. So this kind of sudden cardiac arrests are very common in our country, especially in youngsters at the age of say 35, 40, like that. And those people, if they develop cardiac arrest outside the hospital, it is very important to public to start cardiopulmonary resuscitation on the spot, and usually we have a time only left 1 to 2 minutes to save this kind of patient. If it's more than 3 minutes, they might develop brain injury and may not survive. So then take them to the cardiac specialized hospital and do the complete treatment, what is called as a chain of survival. This whole incidence is known as chain of survival, and this is first case being reported from Chennai, a chain of survival after a out of hospital cardiac arrest. Thank you very much.